The program continues. This is Good Morning Kenya. Thank you for staying with us. Today being a Tuesday, then you know it is Health Tuesday. And today I am joined by an orthopedic surgeon. His name is Dr. Wasena Angira. Dr. Wasena Angira is currently the Chief Orthopedic Surgeon at St. Peter's Orthopaedics and Surgical Specialty Hospital, and he is here to just talk to us about matters orthopedics, you know, the bones, the muscles, the joints, the tendons, you name it. Good morning, sir.
Good morning.
How are you doing this morning?
I'm fine, thank you. And how are you?
I'm very well, thank you. If we may just go directly to you explaining to us what orthopedics is all about.
Thank you for this opportunity to share with the public matters orthopedics. As you mentioned, my name is Dr. Wasena. I'm an orthopedic surgeon at St. Peter's Orthopaedics. And so we deal with everything matters bones, muscles, joints, and everything related to it. So as an orthopedic surgeon, our main focus is musculoskeletal issues, musculoskeletal illness. So that is muscles, and skeleton, and so we deal with issues like our day-to-day matter. We deal with this, like in Kenya, the most common thing we do is treating fractures. As you know, one of the biggest causes of disabilities in Kenya is road traffic accidents. And the road traffic accident will result into fractures, and fractures will lead into disability. So as an orthopedic surgeon, our role is to say, so these fractures happen, how do we manage it? Do we manage it conservatively, or do we manage it operatively? And yeah, so that's one of the key areas as an orthopedic surgeon. The other key areas we deal with the joints. So people with hip pain, knee pain, basically all joints can become painful. And lastly, the most common thing we get in our area right now is back issue. So there are quite a number of patients or people living with back issues. And that's one of the areas that is really rising in Kenya, back pain.
Yeah. Maybe what are the types of orthopedics?
It's really, the subspecialties of orthopedics are quite diverse. As I say, you can specialize in fractures. That is trauma, and you can specialize in sports. So people who have who get into sports, you've heard of maybe a player who has injured their knee. You'll hear them talking of maybe something like a meniscus tear. Those are sports people. So those are sports orthopedic surgeons. And then we have children who are either born with problems like so those are pediatric orthopedic surgeons. So like there are these children who are either born with club foot. I don't know if you've ever seen these children who are born with their leg twisted. So if they are not attended in time, like I remember when we were growing up in our village, I used to see these people who walk with their leg curved, and I didn't know actually that was a problem that could have been solved when they're young. So those are pediatric orthopedic surgeons who deal with such cases. There are quite a number of deformities that children can be born with, from all the way from their back to their legs to their hands. So as a pediatric orthopedic surgeon, you try to capture them when they're still young, and when you capture them when they're still young, you can actually correct
So some of them are actually reversible, because I know I've seen people with, the bow-legged legs. Is it something that is reversible, as you say it?
Yes. So the good thing with advances in healthcare and in our country is that we are able to capture these children earlier on, and this prevents deformities or problems that could arise later on in their lives. Like if you've seen these children with who have bow leg or who have knocked knees, if we capture them earlier on, we don't even need to do surgery. Some of these children, there's something we create for them, something called orthosis. There's a special form of either boots or special form of a gadget we put on their legs, on their knees, that will correct those knees with time. So if they are captured in time, you don't need to even do surgery. If they come late is when now they probably need surgery. So some of this, as I said, advances in orthopedic surgeries, for example, pediatric surgery, help us to capture these children early. So actually, this high time we tell our mothers out there that if you see your child with a deformity, you don't need to hide that child. You don't need to feel like you've born somebody with a disability. You need to bring that child earlier on to the hospital, and so that we do corrective measures, and your child will be able to walk well like every other children who are born normally. So this pediatrics, that's the sector for pediatric orthopedic surgeons, are able to see and capture this deformity earlier and correct them earlier. Yeah, so as I said, there are several branches of orthopedic surgery that we probably may not get into.
We may not have the time to get into.
And there are also orthopedic surgeons who are just specialized on the spine. And so they manage spine. If you have spine deformity, like the children who are born with something called scoliosis or kyphosis, their spine is curved. I don't know if you've ever seen some children with either, or some people even grown up, if they're not captured in time, they walk
a bit bent.
Completely. And or there are some who walked when they're curved. So those are the spine orthopedic surgeons are able to capture those and correct those ones, especially if they are captured at an earlier stage. The correction is really, really better than when they are later in life.
Yeah, and still in line with that, does one need to have warning signs for you to go see an orthopedic? Because, for example, say like cancer, we are asked to go for screening, regular screening, Don't wait until you get the signs and symptoms of it. You go for screenings. Is it the same thing with this? Because can someone like me just decide I want to go see an orthopedic just to check if everything is all right?
The good thing with orthopedic in our area is that we usually joke, we have a joke in medical school that among us all cadres or specialties of medicine, orthopedic is the most direct, is the easiest one. If you either have a fracture or you have pain or you have deformity, the problem is waiting for it to progress. So if you have back pain, there's no really a big warning sign. Just the fact they have back pain, you need to see an orthopedic surgeon. And that will help you in that it can just be a simple change of your sitting position. Just an advice on how to manage your posture, and advice on how, if you are doing manual work, how do you sweep the floor, how do you carry the heavy luggage, how do you basically manage yourself on a day-to-day activity. So there is no like a big warning sign like, hey, go see, there's something subtle. No. Orthopedics really, you either have a deformity or you have pain.
Okay.
So the thing is, go and see an orthopedic surgeon early enough so that you can prevent progress of that condition.
Yeah, but that's only if there's something that is hurting. Like for myself right now, I'm not hurting anywhere, so I don't really need to.
You don't need to see another. There's no red flag.
Yeah.
There's no red flag. For orthopedic surgeon, it's really straightforward. You either have pain or deformity. The problem is when you have the pain or the deformity and you relax. Like most people will tell you unless you're lucky you don't have this, but most people who are working in offices will have some form of back pain, for example, or they will have some form of heel pain. For ladies who maybe put on high heel shoes, they'll have some form of heel pain. So when they start developing that heel pain or pain on their foot, some will neglect it, and then with time it will become a bigger problem that now will not be solved in a conservative way. So most of the time is the small thing that we assume. If you, for example, go to the gym and you start developing some knee pain, it is good to come and see a doctor and say, hey, I'm having this knee pain. What could be the issue? Probably just the change of your exercise pattern or change of your the exercises that you're doing. Probably you're too aggressive. Like the other day I was seeing this lady who was having some knee pain, and she's been going to the gym and she's noticed that her knee is becoming painful every time she's from the gym, or nowadays when she's climbing stairs she gets this pain. And after just taking the small history, I realized she does not do stretching before and after the workout. She goes straight into her workout, and after that she goes straight into showering and leave. So just simple stretching, and because there's a need for, you need to stretch before you go for your workout, and even after workout you need to stretch to relax your muscles, and therefore it prevents developing those kind of problems that may even become a major problem later on. So just changing the focus of her workout is going to prevent her developing problems in the near future. Yeah, so it is just one or two, it's just the small things here that we do that will make a big difference in later on. So as an orthopedic surgeon, we need to just generally the public need to know that, hey, there are these one or two things that we are doing this way. If we do them this way, it will make a big difference. For example, teachers develop arthritis of their shoulder and their elbows. So later on, after they retire, they start developing shoulder pain, and it becomes shoulder arthritis that will probably need now shoulder replacement. So we advise teachers, for example, when you're writing on that blackboard, you need to
there needs to be a way.
Yes,
yes,
because you know, when you're doing an overhead activity, you're straining your shoulder because you're lifting it for a longer period of time. So we need to tell them, hey, when you lift it, when you overwhelm any part of your body, it will bring you a problem later on. So there need to be a balance of it. Yes.
All right, and on that note, we take a very short break. Don't you go too far. We'll be back to continue with this conversation. Thank you for staying with us. Now, before we took that break, you had explained quite a lot on matters orthopedics, and there's something you touched on, but you touched on it in passing, and I want to take you back there. Heels, you know, high heels. Most of us ladies put on high heels. Is it a recipe for disaster in the future? You know, for someone who's used to wearing high heels on a daily basis, is it something to worry about?
Unfortunately, yes. Unfortunately, yes. There is a way our body is meant to be. There's a way our body is meant to be. There's a way our body is meant to have some form of curvature. So just going back to the heel, the way our body, the foot is made anatomically, is that there is in front there are toes. Then there is, in the middle, there's a certain curvature, and then behind here there's a thick pad on our toe, below our the area we call calcaneus. So there's something called a fascia that stretches from your toes to the back of your feet. So there is. The more you put the high heels, the more you stretch that fascia. And the more you stretch it, the more it will get tired, quote unquote. It will get tired and it will give in. So with time, somebody will start having the foot pain, and it's a very common problem. But what I usually advise ladies is, because there's a balance between beauty and pain. There's a way high heel brings some beauty, and there's a way it also creates some elegance on a lady.
It does.
Yes, it does. So the advice usually, like after putting on high heels for about 2 hours, it's good to have, I usually tell ladies this, it's good to have an extra shoes in your bag. So after putting your high heels for like 2 hours, you put on flat shoes. But again, it should not be flat. When you look, the best form of shoes is shoes with a little bit on the back. It should be a little bit raised.
That's
like,
for both genders now.
For both genders. It's nice, like you know, our sports shoes. It has a little bit, it's raised slightly. Like even in school shoes, there's it's raised a little bit behind on the back, just of the foot. So that is the way our feet should be. So that's the right form of shoes we should need to put on. So even when so I usually don't, when you put on like the slippers, the flat shoes for long, you'll get pain. And also the high heels will cause you to have pain. So the best is to just have shoes with slightly raised.
Like an inch?
Like an inch, yes, yes. Okay. Just take the normal sport shoes. That is the right. So even if you have an open shoes, get one that has
it's a bit raised.
A bit raised.
Okay.
Because when it is too flat, again, it's training that fascia. When it's too high, it's training the fascia. So have a balance between your beauty and take care of your heels. So put your shoes for 2 hours max, then put on your right shoes that has some slight platform. Yes.
Advice taken. Says someone with heels on. Anyway, what are some of the risk factors for the common conditions that you treat?
As I said, the orthopedic surgery or orthopedic cases are so broad, extremely broad, from back issues to hip issues to knee to feet. And the risk factors are as diverse as the specialties are.
Yeah.
So, however, at St. Peter's, the most common condition we treat, of course, is fractures. And the risk factors for fractures are again broad.
Yeah.
From for people who are young, of course, the most common cause of their fractures is accident, which is from road traffic accident. Number one, of course, is border, and our cars or buses. So I think that's a bit difficult to say there's a way you can stop getting a fracture.
Yeah.
But now for the older people, there's a very, especially for people who are post-menopause, especially ladies who are on there from 50 and above, they get fractures along on their wrist and their hip. So to prevent those fractures from occurring, of course, is to just take care that you don't, and I advise this for people, for the older people who are on their, from 60s and above, things like you avoid your washroom or your bathroom being slippery, or basically avoid things that may cause you to fall. Just try as much as possible to prevent fall, because if you fall from your 60s and above, the chance of fracturing your hip is very high, and wrist, because that's very common. And also advise them to take, this supplement should not be for everyone. I see everybody taking supplements currently, which is not a very good thing. But for ladies who are postmenopausal, I usually advise them to take vitamin D and calcium supplements. That is very, very important, especially if you have either you are big, like you have a big body size. It's very good to take, it's advisable to take vitamin D and calcium supplements, especially for ladies, because when you're postmenopause, there are hormones that helps ladies to absorb the calcium, and that is not present when they are postmenopause, for postmenopausal ladies. So it's good to take vitamin D and calcium and just stay active. Take a walk. Don't just, even if you're old, don't just sit and relax. Just take a walk, because that will make your bone be strong. The other common thing I've realized is an accident that occurs more often and people don't talk about it is in the toilet. And some people, instead of going to sit on the toilet, they go and stand or sit. I mean, instead of sitting like on the toilet seat, they go and put their leg on the toilet. Yes. And a number of them get an accident and they tear their, what you call the Achilles tendon. Just on the back of your leg, there is a muscle there. So we see a number of patients who have come with a torn Achilles tendon. So when sitting, literally sitting on top of the toilet seat.
Yeah, and this happens in public toilets, maybe because they don't want to be in touch with the surface of the
They slide and then they injure that part. It's a very common cause of, is a common injury that most people...
That's a common injury?
Yes, it's actually a common injury that we see at our hospitals. As an orthopedic surgeon, we see quite a number. When you see patients with that torn Achilles tendon, yes, you are hurt in the toilet, like, yeah. So that's really a common thing. So, so that's just on that. But as I said, the risk factors are broad.
They're really broad.
They are really
we can't
broad.
really
We
go
can't
into
really
all of them.
go into it.
Yeah.
Something that is worth also mentioning is I insist on the back, because it is something that we can prevent, yet it's something that we don't. And once you start getting back issue, you get into other problems that may become, I mean, you don't want to get spine surgery. So the best way of preventing that risk factor, I insist, if you work in the office, you need to know how to sit well.
Actually, I want us to get into that because you've mentioned teachers, you know, some of the occupations that may lead to some of these problems.
Yes.
So if you may just take us through some of these occupations that probably we don't know about, or we assume, you know, that and what to do to try not, you know, get such conditions.
So if, as I said, if you sit in the office for long hours, you'll probably, you need to check how you're sitting, because your sitting position or the kind of seat you're having will result probably into give you back issues. If you watch, nowadays there's this Netflix and chills, like you watch movies for long, so you will probably sleep or slouch on your couch, and by the time, after the long weekend, by Monday you'll have problems with your back.
What's the proper way of sitting? Like on this chair, how am I supposed to be sitting on it to avoid back issues? Just
the same way, you're sitting straight, and if possible you put something on behind the lower part of your back to push it in front. That is, and people who work in the offices tend to slouch in front and have their, like people who work with the computers, they tend to get pain with their fingers. Or even you remember when they used to have secretaries, most of them currently come to the hospital with problems with their fingers. They feel pain on their fingers because they've been typing for so long. So there is a way you need to sit. When you're facing your computer, you need to put your neck and your back in a certain way. As I mentioned, again, teachers have problems with their shoulder. So I advise teachers, and even when we talk to a number of schools, to make that blackboard be in a comfortable position so that they don't lift their leg their hands and their shoulders for long. Other things are manual. People who do manual work, they need to be trained, and a number of companies have started to train their workers on the proper way of lifting weight, because they lift that weight for so long. When they, after working for like 3-4 years, they start getting problems. So different occupations have different kind of, they're predisposed to different injuries. So long as there's a repetitive action, it causes a problem. Yes.
So I want us to look at a scenario where an accident has happened. You know, what is the first step that one should do, maybe as an emergency, that will not maybe even cause more harm when we're looking at fractures maybe that might have been caused from the accident and so on, maybe just first aid?
Okay. So at St. Peter's, we are located along the highway. So one of the activities we've been doing is working close with the border people and the local community, especially the border, to train them on how to handle emergencies at accident site. And when an accident happens, one of the things that can occur is there can be a bleeding, or there's a bleeding from the injury. What we've seen people doing is to take maybe soil or something to put on that place so that it stops bleeding. And that basically becomes a problem to us, because this soil and all that will cross infection on the bone. So when there is a bleeding, just take any, of course you may not have a sterile or something that is sterile glove or sterile gauze or anything sterile, but you are just advised to put pressure, to take that cloth and just put it, where there is bleeding, put pressure on it, just press it for long. And it is not advisable, and we've seen this again, when there is bleeding, somebody goes above where there is the fracture, and if, you know, bladder, they tie up something tight so that it prevents bleeding to continue. And that is very dangerous, because if you leave that for long, there's no blood flow to the other part of the body, and therefore that part of the body will actually die. So the first aid, number one is when there is bleeding, just put pressure. Take any form of clothing and tie at the place where there is bleeding, just tie it so that there's pressure to it. Then if there is anything that is firm, like a cardboard or anything wooden, just put on that place where there's a fracture and tie it so that that does not move. If a patient is, for example, hurt and is lying flat, don't go and carve that patient or hold that patient in a rough way. There are cases where when you get an injury, somebody is injured on the spine. And when you go and carve that person, and probably the spine, so in the spine there's something called the spinal cord that's running from the brain all the way. And that is what transmits the nerves or makes the communication from the periphery to the brain. So if somebody is injured and you're at the site, don't just go and hold that person and grab them or carve them, because that may cause further injury to the spine, and that will cause complete paralysis. And you remember, if you are paralyzed, there is no way of recovering, because most of the time they come late. So the best we tell, when you get somebody at the scene of accident, just hold them, get at least be 2 or 3 people, and hold them the way they are. And we usually, if you don't have, of course, a troll, some way of, just get like a cloth and make that cloth be large enough, and then carry them, the 3 people, somebody protecting the neck, somebody protecting the back, and somebody protecting the leg, and carry them, handle them with a lot of care, because if you just mishandle them a bit, it causes a big difference. Because somebody is probably having a spine problem, and you just go and twist them. Like I've seen people, there's an accident, and then they just carry them and load them into the matatu, or in whichever form of means to rush them to the hospital. You are finishing that person. So just carry them and put them on a larger surface, like a clothing, and now carry them on that clothing and to the hospital.
Okay.
Yes.
All right. As we get to wind up on this particular conversation, maybe what are some of the lifestyle changes that we should adapt to avoid, seeing you, the orthopedic?
Number one is just to take care of our posture. Lifestyle changes that we need to take care of our posture. Weight management. We can prevent so many things with weight management, because the bigger you are, the more strain you put on your body. That is your back, your hips, your knees. So even some patients who come with this knee pain or hip pain, and they are a bit big or they're obese, I just tell them to just reduce, and that changes will stop them from seeing us. Food, too much of alcohol and nyama choma will cause you to have other problems like gout, and of course gout, you know, will make you see yes.
Yeah.
Exercise. With more and more people having vehicles and using public transport, or using, basically, we've stopped walking.
Yeah.
And our work requires you to be dropped at work. You work in the office and then go back to your
Couch.
to your couch, and therefore there's no form of exercise, and that makes your bone to be weak, and you, of course, to gain more. So even if there's the routine, there's a recent study that was shown that per week, if you have a 45 to 60 minutes of workout, is just enough per week. So just ensure that at least you walk, any form of exercise, even walking for 20 minutes every day will gives you that, will be enough exercise for you. So just have a routine of just doing something active for 20 minutes every day. That will prevent a person from coming to see us. Yes.
All right. Yeah. Thank you so much, Doc, for joining us for this particular conversation. Thank you for opening our eyes around it. And I am sure that everyone who is watching us from home, at least they know how to prevent, you know, how to try and prevent some of these common cases that you have just mentioned that you get to deal with on a daily at your hospitals. And yeah, let's just do the right way. If something can be prevented, let's try and prevent it so that we avoid getting to see doctors. Thank you so much, and we hope to have you back on the show so that we can talk about it extensively, because it's a very wide topic, as we've mentioned, and we can't finish speaking about everything today. All right, this is where we end Good Morning Kenya for today. Thank you so much to each and every one of you who has been tuned in on the show. On behalf of everyone on set today, and on behalf of everyone on the behind the scenes, we want to wish you a lovely day. Do enjoy the rest of your viewing. See you tomorrow.